that number keeps decreasing. Unfortunately, pharmacists and physicians need more money to be able to accomplish the same things they're doing now in terms of patient care. So first of all, we need the increases in Medicare, and they need to make sure they're uncapped so that we can maintain the constant business and quality of care.
Healthcare regulation, really the only government agency that does anything in the pharmacy or in the healthcare industry is the FDA, the Food and Drug Administration. And obviously the only thing they regulate is drugs, and has nothing to do with physician care or anything that has to do with that. They regulate drug trials, pharmaceutical research and development, and they determine which technologies are available to be used for research. In healthcare regulation, there can be no real market for healthcare unless the government sets the rules for one. As it is now, the private system, its costs are getting extremely out of hand in some cases, and unless the government steps in, it's going to be even more monopolistic economy in the healthcare department. And the government would obviously need a large role in shaping and overseeing the new healthcare system. Some of the possible ideas include setting up a national technology assessment board. This is to ensure that all hospitals and physicians across the country have access to the same levels of technology anywhere in the country as easily as possible. Obviously in a rural area it might be a little bit harder to have what they have in a big city, but to keep levels relatively equal across the country. And to create an ethics board to review hospitals and insurance companies in cases where patients do end up getting dropped somehow by the insurance company. The ethics board would be able to go in, review the case, and hopefully give the insurance coverage back to the patient who needs it. And also to review hospitals and make sure that they're working at complete efficiency and that the doctor